Action 2014. We're going to get started here. I just want to make a few announcements before we get started with our lunchtime plenary session, which is going to be about outreach and enrollment. And I'm going to turn it over in just a second to my colleague, Rachel Klein, who's going to be moderating this session. But before we do that, I just have a few housekeeping announcements. My name is Jen Beeson. You'll be seeing me around in the conference. You can stop and ask me questions. I'll be coming up here to make periodic housekeeping announcements. What a great morning session. I'm so excited that we had Joe Biden visit us, and what a great speech. And now these guys are going to have to follow that act. I want to let you know that we are going to be live blogging and live tweeting this conference this year. Our hashtag is #HA2014. So please feel free to join in the conversation about the conference. I also want to let you know about something really cool that's happening this year. We have a wonderful raffle opportunity. On Saturday morning, during our plenary session, one of our speakers is Regina Holiday. Regina is an activist and an artist, and she comes and does social media for conferences, and she's going to be painting during the conference. She's going to be creating a painting, and we're going to be raffling off that painting. For those of you who tweet and promote our conference and tell us what you like best about Health Action 2014, you'll be entered into a raffle to win Regina's painting. So again, the hashtag HA2014, and you'll see signs around the conference reminding you of that. Another announcement I want to make is you'll see that this year Health Action is more green than ever before and more mobile. And you'll see signs and messages throughout explaining how you can get connected to online tools, including a mobile app, which you can download on your phone. I saw some of you have already done that, and you can get your conference information through that mobile app. We have wireless coverage throughout the meeting area. The network is Families USA, and the password is FUSA1. I think most of you already have, I've seen most of you have already been connected to the wireless network. Yay. And then, let's see, I want to make sure this is right. I want to draw your attention, we have a networking event planned for this evening. Because we have so much to learn from each other, we've decided to have an evening networking event instead of just an entertainment event this year. We're going to be having a happy hour with hors d'oeuvres and drinks from 6:30 to 8 this evening directly across the street from the hotel in the Liaison Hotel. So please stop by and visit and meet with other advocates. I think that is it for me, and now I'm going to turn it over to my colleague, Rachel Klein.
Ben. Good afternoon, everyone. We can do a little better than that. Good afternoon, everyone. That's more like it. Thank you all for joining us for this luncheon plenary. We're going to have an opportunity to be talking about outreach and enrollment. I think this is a topic we've discussed at least for the last several years here at Health Action, and I'm thrilled to be back with you again today. We've talked about this conference being about making the promise real, right? This is what we have been working towards for the last 4 years, and for the last several months, we have all been working diligently to make sure that as many people as possible are able to benefit very concretely from the promise of the Affordable Care Act, and that means getting them signed up, getting insurance cards into their hands, whether it's a Medicaid card or a CHIP card, or an insurance card for coverage through a marketplace, and making sure that people have the opportunity to actually get the health care that has been promised to them and their families. And so today what we're going to be talking about is how well we have been doing that so far, and what we need to really be focusing on over the rest of 2014 in order to make sure that we have done as much as possible to get as many people coverage as we possibly can. Many of you, let me actually ask those of you, although put down your forks for just 1 second, but you can keep eating the rest of the time. Raise your hand if you have been engaged in some aspect, any aspect, of public education, outreach, or helping people get enrolled. That is amazing. And not anything, I wouldn't expect anything else from this crowd. But I thought it was actually really helpful for us all to see that we are indeed working on this together. None of us is out there alone trying to make this happen. We are all working as part of a broad community to do this work. And we have one another to rely on, to draw inspiration from, to get ideas from, and to help us together chart the path for the remainder of 2014. If you think about it, we have now 68 days left in the current open enrollment period. And you know, it's really interesting. Lots of us have been doing these countdowns for so long now, but I gave so many presentations about how many days until the start of open enrollment. And now we're talking about how many days do we have left until the end of the initial open enrollment period. And it's coming up really close. We've had several months now of experience under our belts, and we've got a little over maybe about 10 weeks left to put it all into practice, benefit from what lessons we've learned so far, and put them into place. And I think it's important for us to remember, number one, our job does not end on March 31st. We have lots more to do in 2014, both to get people enrolled in Medicaid as well as, oh, that got very loud all of a sudden, to get people enrolled in Medicaid as well as to help people who have changes in circumstances after the close of the open enrollment period, who are going to be able to get signed up because they have lost a job, or they have changed jobs, or they've had a life circumstance that makes them eligible for coverage in the marketplace in between open enrollment periods. And then we have a second open enrollment period. And before we meet here again at Health Action 2015, we will have completed the second open enrollment period. So this really is our opportunity to come together and say, where are we now? How far have we come? And where will we be going before we come back together in January 2015? So I'm really excited that we have this phenomenal panel with us today to have this conversation. Let me introduce you to them. To my right, and on the left for all of you, is Dr. Mandy Cohen, and we're really delighted that she's able to join us here today. Dr. Cohen is an internist, and she is also the Acting Director of Consumer Support for the Marketplace at CMS. She's had many, many roles on the implementation of health reform, and we're really glad that she's doing the job she is now, which has her overseeing all of the marketplace assistance programs and consumer casework related to enrollment. Prior to this role, she has been the senior advisor to the administrator of CMS. She has served as the director of provider engagement at the Department of Health and Human Services, where she led efforts to engage the clinical community around the implementation of the Affordable Care Act. And before that, Dr. Cohen was the director of stakeholder engagement at the CMS Innovation Center, where she worked with the Innovation Center's many stakeholders to identify and test new payment and care delivery models. She has her medical degree from Yale, a master's in public health from Harvard, and she trained in internal medicine at Massachusetts General Hospital. So we're really pleased that Mandy's able to join us here today. Next to Mandy, and to my right, is Bill Nold. Bill was appointed as the Deputy Executive Director of the Kentucky Office of the Health Benefit Exchange in September of 2012. Over the last year, this office has worked to establish a state-based exchange that meets the requirements of state law and the Affordable Care Act. Before being appointed to this position, Mr. Nold was the director of the Health and Life Division in the state's Department of Insurance, where he oversaw all aspects of regulating health and life insurance. In 2001, after 26 years of private practice, he joined the legal division of the Kentucky Department of Insurance as a staff attorney, where he focused on issues involving health insurance and workers' comp insurance. Mr. Nold graduated from the University of Kentucky with a BS in mechanical engineering, and then later graduated from the University of Louisville with a JD. So as you can see, we have several very well-educated and dedicated people who are joining us today, not the least of which is Vanessa Gonzalez-Plumhoff, To my left, Vanessa is the Director of Latino Leadership and Engagement at Planned Parenthood Federation of America and Planned Parenthood Action Fund. She's a native of rural West Texas, where she saw firsthand how the lack of access to healthcare resources could negatively affect women and their families. In her role at Planned Parenthood, Ms. Gonzalez-Plumhoff works to ensure that all women, including Latinas, have the information, education, and care they need to make personal medical decisions, including decisions about sexual health and family planning. She works to expand and strengthen partnerships with institutions that serve Latinos and advocates to further Planned Parenthood's mission and commitment to health. She also acts as a key advisor for programs and affiliates nationwide to help improve their outreach to the Latino community. She has an undergraduate degree from Sul Ross State University in Alpine, Texas, and her master's degree from Arizona State University. Thank you for joining us. And finally, last but definitely not least, I'd like you to welcome Antoinette Krause, who is currently serving as the Executive Director of the Pennsylvania Health Access Network. Since joining the network in 2008, Ms. Krause has helped it grow into the state's largest statewide health coalition. She's established the Pennsylvania Health Access Network as a leader in providing education on healthcare reform and the implementation process in Pennsylvania. It currently has over 60 participating organizations representing over 1 million Pennsylvanians from the faith, labor, small business, disability, and nonprofit communities. Antoinette has given many, many presentations about healthcare law, as many of you also have been doing across the country. She's appeared in many news stories and on TV and radio as an expert, and she is currently the Philadelphia Inquirer's on the Health Reform Advisory Board and the Steering Committee for Raising Women's Voices in Southeastern Pennsylvania, and she's a founding member of the Montgomery County Women's Leadership Initiative. And in 2013, she received an Advocacy Vanguard Award from SEPA Pro Act for her organization's work on Medicaid expansion. And Antoinette has a Bachelor of Arts from Allegheny College and majored in political science there. And we are thrilled that all of them are able to join us. I think what you can see from my reading all of these amazing biographies is that we have a very diverse panel who are coming at outreach and enrollment from very different perspectives with different responsibilities for making sure that people get coverage. So one of the things that we wanted to really talk about today is how all of us are partnering together in different sectors and what is the different role that each of us has as we make all of this work. So what I'd like to do is first have each of the panelists talk about what they are doing, how far have we come, and where do we stand in our current process of outreach and enrollment. I'm going to start with Mandy.
Well, thanks, Rachel, and good afternoon, everyone. It's really great to be here, and I just wanted to start with a thank you. As you can see by all the hands raised, this room represents the heart and soul of the outreach and enrollment work, and I can't thank you enough for sticking with us when we had a few tough months and we made your lives really hard. So thank you for all the work you've been doing, the infrastructure that you've laid over, frankly, your entire careers, that we were able to take this moment and really change the country. And so thank you for all of that work, and apologies again for, making that kind of a rough couple months, but we certainly made a comeback in December, and we're hitting our stride now. And so just a bit of an update on where we are in terms of the numbers, and I think you've all heard this, but since the marketplace has opened, we've enrolled 6 million folks in new coverage. That includes private health insurance and Medicaid. And if you add to that the 3 million young adults under the age of 26 who stay on their parents' plan, that's 9 million new folks who have coverage because of the Affordable Care Act. And that's you. That's what you did. So really exciting work. So quick update also on where we are with the marketplace and some of our technology improvements. We have had tons. What's fantastic is there continues to be a ton of interest in this, and I think you have known this all along, that folks needed good, affordable, quality healthcare coverage. And so we've had more than 50 million people visit healthcare.gov. We've had more than 11 million people call our call center. We've had more than 8 million people chat with us online. We have over 20,000 assisters out there who are fully certified and trained, who are helping with enrollment. So a lot of work really going on out there. Healthcare.gov certainly had its challenges, but really now is certainly working quite well. I'll talk a little bit about some of the challenges that still are out there for us. But error rates are down, the pages are loading faster, folks are getting through the system, as you can see by the numbers coming out the other end. So I think we're still very excited about the progress, and we continue to make progress every day and put in new fixes every day to the website. We've also established for those consumers who do have more challenges getting through the system, and we know that you in particular likely interact with those folks who are having more challenges getting through the system, who are more complicated. We've now established a very robust casework system that's in place, and we're trying to be as responsive as humanly possible to make sure that we get those folks through the system and into coverage that they need as quickly as possible. So that's where we are in the casework. And then we're turning our attention now. As I said, I think it's a new moment, a time to take a breath and say, we have 68 days, wow, I didn't know that, but 10 weeks of rest of open enrollment, and this is it. This is game time, it's critical time, no stone left unturned for the next 10 weeks. You're gonna see that from the administration. I think you heard it from the energy from the Vice President today. You're going to see the cabinet traveling. You'll certainly see my boss everywhere in the next several months, traveling, Secretary Sebelius, just to raise awareness as much as we possibly can. You'll see a much larger paid advertising campaign, and really anything we can do to assist you over the next 10 weeks. But also, as Rachel mentioned, it doesn't end on March 31st, and we certainly know there's a lot of work to be done, improvements to be made for year 2, which frankly isn't that far away. Year 2 is actually in 6 months. And so a lot of work still left to do, and excited to do it together. So looking forward to the rest of the conversation. Thanks,
Mandy. Bill, Kentucky has been going like gangbusters. Yeah.
Thank you so much, and it's been through the efforts of folks like you that we've been able to reach some level. Am I supposed to turn that on?
Nope, they're taking care of it.
Is that on now?
I'm just loud.
Here.
There we go. There we go.
Okay.
Can you hear me now? Again, I wanted to echo the thoughts of Mandy there, you know, about all the good work that you all have done. And this just hasn't been over the last few months. It's been over the last several years. I've not been involved in this process for as long as many of you have. But I did want to share with you some things about Kentucky that I think, but at the same time, I don't want to step on Governor Beshear's going to be here tomorrow, you know, and so he's going to be very anxious to share a lot of things with you all, and I don't want to steal too much of his thunder, but I want to give him credit where credit is due, not because I'm looking for a raise or anything, but so, you know, Kentucky, we're the only state in the South that is pursuing a state-based exchange. Kentucky is bordered, there's 7 states that border on Kentucky. None of those states are pursuing a state-based exchange. Some are partnerships. We didn't vote for President Obama in Kentucky in either election. His popularity is probably not very high in Kentucky. So, you know, what's the deal? I mean, how come that we've had some success, at least at the beginning here? And I do want to give credit to the governor, because his approach maybe is a little different from what you normally hear about. From day one, after this law was passed, we started having, of course, even before the law passed, we were in a mode of trying to develop stakeholder support, so on and so forth. But in the very early conversations with him, we presented pros and cons. Here's what you need to do, Governor. Here's the bad side of this and all that. And so he didn't really want to listen to much of that. Well, what he, and daggone it, I'm going to step on him a little bit because he's going to tell you this tomorrow. But healthcare statistics in Kentucky are horrible. We're at the top of every bad list, not necessarily at the top. There might be a couple other states higher than us. And we're at the bottom of all the good lists. You know, so when this law passed, he looked at this law as an opportunity to improve the health of our state. Not so much an opportunity to lower costs, these other things that are important, but he wanted our state to get healthy. So we presented all the pros and cons to him, and he said, look, he said, here's what we're going to do. Now, I'm kind of paraphrasing here, but he said, look, I'm going to take this law and use it. I'm not going to take and let this law use us. So he said, there's a lot of things wrong with this law. They can have all kinds of improvements to it, but we're not going to wait. Well, we're going to wait till the Supreme Court decides before we jump in. And so Supreme Court decided, and so we met again, and he says, okay, here's what I want to do. He said, I want you all, and he pointed his finger, to do everything that you can to take this law and use it to improve the health of our state. If that means we do a state-based exchange, we'll do it. If that means we expand Medicaid, we'll do it. If that means that you have to go out and get grants from the federal government to support your efforts, we're going to do it. But he is tremendously dedicated and has been since day one, and that's really why this thing has taken off. Now, we've done a lot of things. Of course, we expanded Medicaid, and we went the state-based exchange. And you talk about, you know, for a year, we're working on getting approval from CMS and CSIO to operate a state-based exchange, and it all came down to September the 30th, and it's about 6 o'clock, and we've been given permission to connect. That was a huge milestone. So we're all in a room, probably 100 of us, and our vendor is right there in the same building that we're in. And so Carrie Danahan pushes the button, and it happened. You know, it came up. We got connected. And so we all went out and had an adult beverage. And you know, we're so happy as to what we had accomplished. But at the same time, it was, you know, this is just the beginning. All of our efforts had led up to that point at that point in time, but we hadn't accomplished anything yet. So the next day, we got slammed. Our website got slammed, and now our website's never been down since it's been a little slow. But for about 6 hours on October 1st, we had some problems that slowed the process way down and took our smart IT people, about 6 hours to figure out what the problem was, and so we added some memory and all these kind of things, and so we solved it. So it's been going gangbusters ever since. And just to give you, now all the numbers that I was going to tell you about are now on the floor, but just to give you some idea, that's great. This was as of January 17th. Where's the second page of this?
I don't know. Can't help you there. Sorry, Bill.
I'll just make them up. 162,000 people have become enrolled in either a QHP or Medicaid. over 500,000 people have come onto our site and have browsed anonymously to see what they might be entitled to. That's as far as my memory goes on this stuff. About 25% of the enrollments are QHPs, and the rest are Medicaid. But we predicted that. We had 640,000 people that are uninsured in Kentucky, and we estimated about 300,000 would be entitled to Medicaid under the expansion. The rest of the folks, I think it's around 85% of the rest would be entitled to some kind of a premium assistance, advanced premium tax credits, or cost sharing reductions. Things are going good. I don't know if I can recite every reason why I think it's going good, and we'll talk about some of those things, in a few minutes. But we're anxious, and again, we're only halfway through the first open enrollment period, so we're just going to keep it going.
All right, well, thank you. Okay, so we've got the federal government and state governments working really hard, but we know they can't do it on their own. They get the systems up and running, and there's a lot. We'll hear more about outreach and enrollment, but we've got to figure out how to tell people that all of this is happening. Tell us about what Planned Parenthood is doing and what your effort is in particular.
Yeah, absolutely. Everybody hear me okay? All right, good. And just to one point, I think a lot of us have had adult beverages throughout this whole process. One or two. No, first, thank you so much, Rachel, and thank you to the Families USA team for allowing us to be a part of this amazing panel. We really appreciate it. Planned Parenthood, under the direction of our president, Cecile Richards, we know we have a very unique voice when it comes to women's health care as one of the leading providers throughout the country on reproductive health. It was never a question as to whether we were going to get involved in the ACA fight and expanding the knowledge and education base of those people who come to us for basic information. It was just a matter of what is our voice, what's our role in that conversation, and how do we do that? So we were able to launch a multi-pronged approach, website, which we'll talk a little bit later, website, text messaging program, and as of this week, we'll actually be running ground games on the fields, knocking on doors in 7 states, excuse me. We're already hitting over 10,000 doors a day. And of the people that we have spoken to so far, in 2 of those states at least, 55% have worked with us to actually start enrollment. So what we know is that Planned Parenthood is a very trusted advisor when it comes to this information. We're already a trusted advisor in the communities that we serve. And so it was just taking the engagement another step. We are very deliberate in making sure that when we are talking to folks under the Planned Parenthood banner who are doing this work, that they're having a conversation, because every family is different, all the needs are different. And we want to, again, continue to build that trust that we've earned and continue to build upon it and make sure that we're providing accurate information. From where I sit, particularly as the Director of Latino Engagement, I'm really excited because of those 7 states. 5 of them are with the highest Latino populations in the country, so Southwest and Florida. It is amazing for us. Right now, I just came in from a training where we are onboarding another 33 organizers to hit the ground. Everybody is bilingual. All of our materials are bilingual. The website that we have set up in Spanish allows you to begin the process, at least on our end. It gives you an interview guide, and this is both for the English and Spanish. It gives you an interview guide so that as you're going through the process, you know what questions to ask your prospective insurers. It also gives you questions, what do you need? What is the plan that would best suit your family? A plan finder, depending upon your state. So we really designed this to talk to those who come to us for care, so they feel comfortable in going through this process with us for as long as we could take them through the process. I'm really particularly proud of our Planned Parenthood asegurate.org site, which is fully in Spanish. A lot of times in this work, what we find is that it's either a direct translation of the English, or the person who maybe is more comfortable in Spanish language, Spanish dominant, doesn't get the full experience. And so we were very deliberate in making sure that everyone who needs the information and access to care has that opportunity to receive the full breadth of information. Same thing with our trainers. It's really fascinating because we're already hearing stories back from the field when people are knocking on doors, and because we're able to come into the homes and have some really difficult conversations, we've gotten reports from canvassers leaving because the people are crying and they've hugged them and said thank you because they didn't understand what this law meant, or they didn't understand anything about the tax credits. They didn't know what services, particularly from Planned Parenthood, obviously the preventative health care services, love, very grateful for that, especially the birth control benefit. We know from about a third of Latinas in the country in particular have delayed seeing a physician due to cost. We know birth control can cost women about $600 a year, that's on average. And so being able to tell these women that they can go get this care that they need before it's too late. Latinas are also 20% more likely to die from breast cancer, highest rates of cervical cancer. So being able to say you don't have to wait until you feel bad, until you don't know what's going on, you can go now, and we're gonna help you get there, and we're gonna help you throughout the entire process. It's just been an amazing feeling for us federation-wide, and so we're really proud of that work.
Something that I think is so important, and I've heard this from people across the country as we've been talking to different enrollment assisters and people who are actually out there talking to the community. How many of you have had that experience of the consumer who suddenly understands what this is all about, suddenly gets that they are actually going to be able to get coverage and have that one-on-one feeling of really having made a connection and help someone change their lives? So that's something I think all of us who are out there who are talking to people are going to have this experience over the next several months, and it really does bring home the importance of what we're doing. Antoinette, so here you are, getting the word out, helping with implementation. It's a consumer health advocate working in an FFM state. Not as many resources probably as you would like to have in order to blanket the state with information. What is it that you all are doing, and what's your role here?
Yeah, so can people hear me? Just a quick question. How many people here wish they had 33 organizers on their staff? Yes, we come to this, we're a statewide coalition, we're a small staff. We have a staff of 3 for the entire state. And we did a lot of organizing work around passing the Affordable Care Act. So we wanted to hit the ground immediately running and figure out where we could best play a role. So, you know, right after the law was passed, maybe 2 days later, we were out in every corner of the state educating folks about what the healthcare law means. At the end of last year, we hit 1,200 presentations across the state. So we wanted to increase the capacity, and thinking about who are the best messengers in the local communities, we worked on developing a leadership program. We have trained 100 leaders across Pennsylvania. These are physicians, nurses, retired professors, pastors of local churches, nonprofit organizations that have really committed a large portion of their time to going out and educating folks on the Affordable Care Act. People apply to the program, they have to commit to an almost full day training, they have to pass an oral and written exam, and commit to do 12 presentations throughout the year. When our advocacy director first came up with this idea, I said, "You're crazy, who in the world is gonna commit all of this time to educating folks on the ACA?" And we've just had an overwhelming response. We have 4 more trainings set over the course of the next couple months. And we just, put this program in place in the past 3 months, and already, we've had 50 trainings happen in Pennsylvania just from our volunteer capacity. We also did a lot of evaluation internally about, should we be a certified application counselor organization? Do we have the capacity to do that? And we realized that we had a very important role to play, and the answer was yes. So we've used our training as kind of a baseline to also recruit volunteer certified application counselors. We have 7 certified application counselors right now that have gone through both trainings, that are out doing education and enrolling folks. They've hit about 270 people and enrolled approximately 100 folks. We have 4 more in the pipeline, and we also help organizations become certified application counselors. We also, because we're a federally facilitated state, the Navigator funding was very limited. So there are pockets in Pennsylvania that just don't have the funding to have navigators on the ground. So we looked around and said, well, what capacity can we play in rural Pennsylvania where we've built a large base? So we're working with local colleges and universities to recruit college students to be certified application counselors that are getting placed in VITA sites or local libraries or soup kitchens in their community. And then as a state health coalition, we want to make sure that all of our partners have the resources they need to be successful in this. So we launched a certified application counselor network and navigator network that meets monthly. We're probably going to meet bi-monthly through the end of open enrollment. It's a work group where people share success stories, problems, and best practices. We've been very lucky that both our regional HHS office and our local CMS office have participated in all of the calls. So it's very interactive and people can share, problems they're having and really support new folks that haven't been doing this work that are on the ground. And lastly, earlier this month, we, with several partners, launched Insure Pennsylvania. Robert Wood Johnson saw that there weren't as many resources in Pennsylvania, and we thank them for this. So we launched Insure Pennsylvania, which is a group of certified application counselors working to coordinate with Enroll America how to get certified application counselors in communities, at events, and in organizations' offices that are on the front lines, that are interacting with these constituencies.
That's great, thank you. So I knew this was going to happen. We have so much to cover in this session, and I know we're going to run short on time, but I also want to incorporate questions that you all have as I am talking with our panelists up here. I believe that there are cards somewhere on your tables, and so if you have questions, go ahead and fill out your cards and then hold them up and someone will come by, and hopefully I'll get an opportunity to ask as many of those as I can while we're going through the rest of our conversation. But go ahead and start thinking about and writing your questions now. So let me ask Mandy, and then I'll turn to Bill and I'll ask you the same thing, I think. We've got a few weeks left, right? I know it's coming up quicker than you want. But we've also made a lot of progress. Obviously started off slow. Things were not what we wanted them to be at the very beginning. They've gotten a lot better, and December was really impressive, right? We had lots and lots of people who were able to sign up in December. What is it, how do we keep the momentum going through the rest of open enrollment?
Right, great question. And I think the second half of open enrollment will feel very different than the first. One, we won't have October and November. But what happened in December, and I think we all sort of anticipated it, was that the folks have been waiting for this for a very long time, and needed the insurance and came knocking on our door, which is great. And we wanted to welcome them with open arms and enroll them. And I think what the second half of open enrollment is to make sure that we aren't just waiting for folks to find us, but that we are making sure that we are being proactive in finding them. I think there's been a bunch of new studies recently, still health literacy around health insurance and using insurance, and those work terms are still very, very low. I think there are still way too many people who don't know anything about the fact that there's financial assistance to purchase insurance. So what you're going to see from us is more of the proactive, going out and getting the folks who don't know about us, who maybe have only read the bad headlines, that this is complicated, it's not possible, it's unaffordable, et cetera. And we need the trusted voices out there to really regain folks' trust, because we did lose that. I mean, that's what happened when we had our issues when this started, is we need to rebuild that trust and make sure that folks just take an honest look at what options are there for them and make decisions that might make sense for their family. So you're going to see us look out and do that. And so I sort of mentioned you'll see much more in the way of administration officials traveling. You'll see a lot more paid advertising, TV, radio, online. We launched some new efforts with some sports celebrities, particularly to reach out to a younger demographic who aren't waking up every day thinking about health insurance. So using folks like Magic Johnson and Alonzo Mourning, who have had their own health issues and can really connect to folks who might be going through some similar things, and to raise awareness. So I think that's what you're going to see from us, and then using every creative mechanism we think we can. And We want to hear from you about how we can help and support you in the work that we're doing, but I think we're excited about hitting our stride.
That's great, thanks. So Bill, how are you going to keep the momentum going?
Well, I guess we're going to keep on keeping on in a way. Things are working pretty good so far, and but we already have commitments for our advertising. Doe Anderson, who's our advertising agent for all the way through 2014. So we're going to use the funds that we received in the grants to keep that advertising going. The advertising is, typically the print media and also television, radio, bus advertising, all of those things that you think about. And in the process, we developed some characters. I don't know if you have seen these characters. We didn't have to hire any actors. They were all animated. So, they've become very popular. And they present the image of, and the point that I want to try to get to, they present the image of that it's not government that's telling you what you need to do. It's more these characters who are culturally diverse characters are suggesting here are ways that you can help yourself. So the message is not one from government. It's one, people don't trust government, they don't. And so the idea is that as we get more and more people enrolled and we start having some good successes, and we hear stories about how the lady with breast cancer this morning, for example, that word of mouth is going to be the best thing to keep this thing rolling. When people find out how other people are being helped. Everybody knows somebody, whether they're family or friends or whatever, that doesn't have insurance. And what our governor has said is, just go out and take a look at the site and see what might be there for you. And that's where you folks come in, and that's where the navigators come in, and that's where agents come into the picture. So we're going to keep on keeping on.
Sounds good. I think one of the things that you raised is something we've been particularly interested in too, which is story banking, which is collecting stories about people who are successfully able to get signed up and trying to share those out as broadly as possible. We have, for folks who haven't seen it yet, a project called My Coverage Story. It's something we're really excited about and hope that you'll check it out at mycoveragestory.org. And let people know so that they can share their stories, and we can try to get many of those out there as possible so that people will be encouraged to sign up themselves when they see someone just like them has been successful at it. Vanessa, can you talk to us? I also want to hear how we're going to keep momentum going, but I know there have been a couple of reports out recently that have shown that we haven't been as successful as we'd like to in getting the word out, particularly to Latinos. And so I wonder if you can talk to us, what are some of the barriers that you're seeing, and how can we get past those and really build some momentum in the Latino community?
Yeah, absolutely. Pew came out with a study, and I believe NPR also has some information that they released this week about the lack of foundational knowledge about what insurance is writ large across the Latino community. We know it's particularly low. On our side, to try to address some of this and working with Enroll America and our partners over at HHS as well, has been to disseminate some of the basic information, right? We get questions about, well, if I already had insurance or I signed up for insurance, when I go to the doctor's office, why am I still having to pay? And so we all had to reset and take a step back and really begin from a foundational of, okay, this is a copay, this is a deductible, and that's where I think our interview guide also comes into play. It has some really basic definitions in there for insurance. And I think, to be fair, I think it's something that a lot of us took for granted. And so going through the ACA has been this exercise of really realizing where the community is at and needing to take that step back and really meet people where they are. What we're finding on the doors is that a lot of our canvassers and organizers are having to answer some of these questions, and so we've armed them with that. As best we can, we're trying to overcome that, whether it's through a digital space, whether it's through interviews, whether it's through working with community partners, which we're really encouraging everybody on the ground to do so. And it's part of that one-on-one conversation and building that trust, right? Now, you can't do that for 11 million Latinos you have to kind of do that in mass. And so we're taking it in different areas. You know, we ourselves have a Twitter campaign that we're working on. We're partnering with other people, you know, to make sure that we're getting that message out as much as we can in both languages. Some of the other things that we're hearing at the door is also the concern about immigration and how this overlays, particularly for mixed status families in the home, and mass confusion about what that means. What are you going to do with this data? What are you going to do with this information? So despite the administration re-releasing the guidelines to try to reassure families, you know, that this information is being obtained solely for health purposes and health insurance purposes. It's not as an immigration trigger, anything like that. We're still coming up against that quite frequently. And so we have armed our folks as well with basic knowledge on you know, how to engage in that conversation. And if the person who opens the door themselves may not be eligible, then we need to ask about the family and be very culturally aware and know that there is someone in the house who may be able to sign up. And what does that mean if you are a parent who is not eligible but your child is? And what kind of information has to be provided? So we're working on that. I think we're working on that with some great partners, Enroll America. I know National Council La Raza, LULAC. There's tons of organizations trying to push this out into the community. The other thing, you know, to get to the point about having to have one-on-one conversations is we're launching Latino enrollment summits across the country. We have 12 cities that are slated, and those are literally working with community partners, bringing people in, and these are for enrollment. We're doing education where we're making phone calls, we're making sure people understand what documents they need to bring in. We're trying to make them very family friendly and community oriented, so we're doing partnerships with dental vans, children's immunization. I think we have a couple bouncy houses and face painters lined up, those types of things, so that people, we know the community will bring their family and actually start the enrollment with a navigator, certified assister on hand.
And is that list of 12 states available someplace in case folks hear there's one in one of their communities and they'd like to plug into that effort?
Yes, absolutely. We can get you those lists of cities. Also for the states that we are particularly working in, I'll just rattle them off, that's fine. We're doing Pennsylvania, Ohio, Texas, New Mexico, Colorado, Arizona, and Florida. And so those are our 7 states where we're putting a lot of resources and efforts in mass. And so I'm more than happy to try to start partnering folks up.
That's great. Antoine, I actually have a question that someone gave me, which is almost exactly what I wanted to ask you anyway. So a lot of what you're doing is really focusing on galvanizing volunteers and helping folks, sort of bringing people together to try to start thinking about how to do community-based outreach and enrollment. So for folks who are newer to this world or who are trying to engage volunteers, how do you get that process started? Where can they connect up if there isn't already an existing network?
So folks, we're happy to talk to folks offline if you're interested in getting this up and running. But, you know, we had built a base through the healthcare movement, so it was, you know, essentially a little easier for us. We had folks that were engaged in the issue. But then it's a lot of one-on-one conversations with organizations that reach these populations that aren't thinking about healthcare or the role that they can play, or they're trying to play a role but they don't have the right resources. So it's really developing the tools and devoting time to develop leadership in organizations, but also develop the time to develop strong grassroots leaders. You know, our staff was being run into the ground by doing all of these presentations. We were on the road, you know, 7 days a week. And then looking at it, we were like, well, are we the best messengers for some of these communities? So, you know, how can we reach more folks? Well, let's go recruit, you know, a pastor of the local church to take our training so he can set that up at his community. Or, you know, physicians are very trusted messengers. So, you know, we reached out to some of our networks, the National Physicians Alliance, and said, hey, do you guys have folks that we can train? So I think it's thinking about who you have as part of your network and how can you engage them if they're not already engaged.
Thank you. Mandy, I've got a lot of questions here for you, as you may expect. So one of them is, what about after March 31? What is HHS going to be doing between open enrollment periods and beyond the first open enrollment period? Anything you can say to us about that?
Sure. I'm going to take a vacation. Oh, you mean the rest of everyone? No, so obviously March 31st, is the close of open enrollment, but clearly Medicaid enrollment does not have that deadline, neither does the small business marketplace. So there will continue to be work and enrollment work throughout that period. And then obviously we still have cases that we need to work through in terms of folks who ran into glitches and problems along the way. So we know we'll be working through a lot of those issues as we go through hopefully the next couple of months there. But then, like I mentioned, it's really about we know that we're going to make improvements to the marketplace and to what we've been doing as we go forward. So particularly in my world, related to assessors and casework, the Navigator grant program in particular was a one-year grant program. We intend to issue another grant for the second year. So there will be another funding announcement related to that, and so work for organizations to, put an early plug in to look out for that. And then it's the issuers are going to resubmit their bids in terms of putting their what products they want to sell for the next year already. They're going to be doing that as early as May and June, and they will look at what's going on in the first open enrollment period to set their prices for the second, and then we're going to hit the ground running for new training, and we'll actually be able to train people on the actual healthcare.gov site because we'll have seen it this time, and so we'll be updating training and be doing a lot of work over the summer again to build our infrastructure, things we wish we could have done the first time around and want to do for the second time. So work certainly continues, and it maybe, if anything, gets busier again, which I can't even imagine, but yeah, so that's what we're looking at.
I know several people are curious here about whether there's been any discussion about extending the open enrollment period beyond March 31st, given the delayed start and the problems that we've been experiencing.
Well, that is something certainly above my pay grade, but no, I mean, open enrollment is to the end of March, and so I think we made a pretty good comeback in December, and I think folks feel like this is quite a long open enrollment period. If you look at other standard open enrollment periods, they're certainly not this long. And if I'm thinking about my 30-year-old brother who needs health insurance, who is going to put something off until the deadline you give him anyway. So if it's March 31st or April 31st, he'll just pick the deadline day.
Okay.
But so we think that we've given folks an adequate amount of time, even with this, our issues at the beginning. So I think we're locked there.
And one other question that has come in, actually I have this in different iterations a couple of times in here. Lots of folks here are engaged in enrollment assistance work as funded navigators or in-person assisters in a state-run exchange state. What do you anticipate? And I know one of the issues that has been raised is that at least this year there was a real imbalance in the amount of funding available for in-person assistance in the FFM states versus in state exchange states. That may change next year. We don't know yet what's going to happen in those state-run exchange states about how many navigators they're going to be able to support.
Right.
But what is your guess about what is likely to happen with support for in-person assistance in the FFM for next year?
So I think, we all wish we would have more resources and things are tight. As you know, we don't even have a budget for this current year. We still need to work out in terms of what we can do to continue the marketplace going forward. So I think there's a lot of work in progress here, but I think there's certainly a commitment to continue the Navigator program. I think folks are seeing the value of in-person assistance. As far as the balance, I think that's yet to be seen.
Okay, that's helpful. Vanessa, I have a question for you about how Planned Parenthood is advocating for health coverage for pregnant, lawfully residing immigrant women.
Yeah, no, that's a great question. We have been working with coalition partners when it came, so Planned Parenthood this year, we did take a public stance on immigration, and we came out on what we believe is the right side of immigration for comprehensive reform. Part of what we fought with our partners is that included health care, and that did not happen. But we're continuing to try to lift that up and push that forward whether it's in the immigration fight for CIR or whether it's in continuing health, finding new health champions. Maisie Hirono recently put forward some legislation that addresses immigrant health care. And so we really believe our motto for our health center site is care no matter what. And so for us, it's really a matter of going forward and providing health care for everyone who needs to see us. And so we're advocating on all fronts for everyone to have equal access to that health care. A lot of it is maybe there's the public fight that we have and the public advocacy side that we have for the ACA, and there's also, working with through our governmental relations team and with our coalition partners in different spaces to figure out what is the best way to get that message across and really work to ensure health care for all.
Thank you. I want to note for folks that although we only have time for I think 1 or 2 more questions here, we're going to have other opportunities through the course of the conference to be talking about different strategies for reaching particular populations in a couple of different workshops that are in your agenda over the next several days. We also have workshops specifically around enrollment assistance and how to structure programs and lessons for enrollment assisters. So I wanted to just draw those to your attention if you did not have an opportunity to ask a question here, or if you have specific things that you wanted to discuss about reaching specific populations. We will have further opportunities to do this after this plenary today. But before we do wrap up, I do want to ask just each of our panelists to talk a little bit about, if you could, aside from IT and making it work, what do you think is the biggest lesson that you've learned so far that will help us get to where we want to be for the remainder of 2014? Mandy, why don't we start with you? I'm looking at you.
I will say it's early to draw conclusions about this open enrollment period, and particularly about when we step back over the whole 6 months, when we have a fully functioning site for a good period of time, and what lessons we can learn from that. So I just want to caution folks from drawing too many lessons until we can really see particularly what the next 10 weeks will look like. But the one thing that I think that we have seen be successful over and over is something that's been mentioned by other panelists. It's about the telling personal stories. We obviously our credibility is quite low in the federal government, particularly after our website issues, and I think we can't just tell people that this is a good thing. You have to show them. And the way you show it is with someone who's actually gone through the process, gotten financial assistance, is finally getting affordable coverage. And so for us, the take home has really been about it's the show the success and not tell about the success, and pointing to those personal stories. And we've definitely changed our outreach tactics because of that. When we were originally thinking about some of our advertising, it was paid advertising, it was much different, and what you're going to see going forward are a lot more testimonials from individuals that might look like your neighbor. And I think that's, for us, we've really internalized that as a lesson. And it's not about just trust me, go to the site and it'll be great. It's look at your neighbor who had a success story, and I think that was a page we took from Kentucky.
Wonderful. Bill, what do you
Sure.
think? What's a
Well,
lesson or two that you have learned that will help us get through the rest of 2014?
I think that probably the first part of our open enrollment period was what we did the best we could to overcome negativity, to make it okay for somebody to go out and see what Obamacare is all about. It's okay to do that because it's really not about Obama. It's about those people. So I think the lessons learned there are doing whatever we can to continue the whole concept that it's okay to go out and take a look. Even if you're an extremely conservative Republican, it's still okay because, health doesn't have anything to do with whether we're red or blue or it just doesn't have anything to do with that. So I think the continuation, that's the lesson. And that I guess the other lesson is that there's a heck of a lot of people out there that want to get coverage. They haven't had coverage, some of them, in our state ever. And we're hearing stories like that. So, I guess, we're trying to make our website a little bit more friendly and usable and put some of the bells and whistles that we tried to go very basic, but as we move forward, we'll have some more things out there. And so I guess the lesson learned is that they're in Kentucky anyway, they're hungry to get health care coverage.
I made a mistake with the time, and I'm so excited because we actually have more time to talk. I'm thrilled. I kept thinking we were ending at 2 and I needed to get you out of here, but I don't. So I'm really excited. We have time for more questions, which means I've got time for more questions for all of you. So please, if you haven't filled out a card yet and you have something that you'd like to ask, please do that and someone will be by to pick it up. But let's go continue with our theme. Lessons learned. What have we learned so far that's going to help us?
Yeah, I think we really learned that we knew we had a unique position and voice in this conversation. I think the speed to ramp up to get that voice out there was very short in length of time, and so our lessons learned is that the one-on-one conversations is really where it is at. To be able to see people and hear their stories and be able to have that conversation about what they need for their family and their own health care has been extremely valuable lesson. It can't be something that's just done from the 50,000 foot up. It has to be very grassroots and person to person. And so for Planned Parenthood, with our affiliates across the country, I think it's a different conversation when you're having a healthcare conversation with someone who's sitting in your health center. And so for staff and volunteers and advocates to be out in the community and really knocking on those doors and getting into the homes and having some of these nitty-gritty conversations with people has been invaluable, and it's just been really amazing lessons learned and great stories coming back.
Antoinette?
Yeah, I think for our organization, one of the biggest lessons learned is you really have more capacity than you think you do, and you really need to dig deep, and it's an all hands on deck approach. So it's really looking at, everyone in our organization as a CAC, it's who do we have that can help with this process? And there's a lot of people that are out there that want to help, they just don't have the tools, and they still think, the Affordable Care Act is confusing and complex, and we just need to help simplify that process for them. I think the other thing is, it's really important to meet people where they are in the community. So when we schedule enrollments at our office, we see a huge drop-off rate. When we're, at the library around the corner, 95% of the people show up for enrollment. And I couldn't have a conversation about outreach and enrollment without talking about Medicaid expansion for a minute. We're a state that currently doesn't have Medicaid expansion, and it's really important work that we need to continue doing in states. And I think we've learned a lot about, as we talk about outreach and enrollment, we need to continually talk about the folks that are coming that are left in the coverage gap. And we've done a lot of messaging to figure out how to engage those folks, because let's face it, when they come into your office, they're all happy. They think they're going to get healthcare coverage because they read in the news that, it's their turn, they can go see their doctor. And then you have to have that conversation with that person that's like, look, you're in this coverage gap, you can't get healthcare coverage. And it's, breaking down that anger and disappointment and fear and really working with them to engage them in a campaign, that's going to go on for a few more months, at least in Pennsylvania.
So I've got a question here that I'm going to ask to Antoinette because it's actually written on here that it's for you, but I'm also going to ask it of Mandy as well. And this person has said that they are a physician volunteer organizer for Enroll America in Chicago, and really has had an experience with doctors being very negative about the law, and wants to know how do physicians and assisters in Pennsylvania, what do you say to other doctors about Medicaid expansion in particular in order to get them more enthusiastic?
Yeah, doctors are a key messenger in Pennsylvania, and we're actually fighting a proposal that has significant cuts and would limit people's access to their doctor. So physicians, nurses, they're really key messengers in this. We're lucky in Pennsylvania. We have a strong National Physicians Alliance presence. We also work with Doctors for America. So they've been really able to connect us with doctors who are pro-ACA and really want to be engaged in Medicaid expansion, and have been great in engaging other doctors on this. We know it's tough. I mean, we've been out giving presentations, and there's always that doctor, especially specialists, that, it's just not beneficial to them. But that's why it's so important to engage physicians, and I would reach out to National Physicians Alliance and Doctors for America, because physicians having conversations with physicians hold a lot more weight than, our organization talking to physicians about this.
So Mandy, I know you're obviously not coming from a perspective of trying to engage people in Medicaid expansion advocacy in the same way that Antoinette is, but with your personal experience, I wonder if you have any, and I know physicians are important partners for CMS in all of our outreach work. Is there anything that you can say about how you've been able to engage physicians in this effort?
Sure. As a primary care doc, I know how critical it is to engage the physician community. I did want to give a shout out to my friends and colleagues at Doctors for America who are here over there. So if anyone needs to want to talk to doctors or not feeling well, anything like that, they're over there. They, obviously do fantastic work and are building coalition, and there are a lot of doctors who are working on this and can be really strong advocates. But the bottom line is that we know, looking just at the science, I'll put on my scientist hat for a second, is that we look at the science, coverage saves lives. Coverage makes people healthier, and that's the reason we went to medical school. So I think it's a lot of connecting with physicians really about, trying to get their patients the best access to care. And yeah, do we have other issues to deal with? And that's the other hat I wear at CMS in terms of once we bring them into the system, do we need to make improvements? Yes. Yes, we do. But does that mean that everyone deserves and has a right to get that care? Yes. And so I think that's where you want to approach physicians and other clinicians, is really that fundamental gut reason why they went to medical school and why this is really important, and bring them back to the science. Pull out those journal articles for them about mortality decreasing when someone has healthcare coverage. So those are my thoughts.
So let me ask a question. This is actually a really a key question for all of us as we think about what is it that we're doing that's working? How do we know it's working? Obviously we can look and say that people are either signing up or people are not signing up. But thinking about our particular outreach efforts, how are we measuring our efforts to find out whether or not what we're doing is working? And maybe I don't know, Mandy, if there's anything that you can say about how CMS is thinking about this issue.
So how do we know things are working? We try to go back to the data as much as possible, and we're trying to get more and more granular. It's challenging right now to try to get there, but as much as possible, we try to look for data, and we encourage our assisters all the time to be tracking what they're doing, how many people are showing up in events, those kinds of things working. We track, anything from touches to consumers, news hits, and then obviously the gold standard of did they actually enroll. And I think as we get better data, we'll be over the next, we're very close to getting some much more granular data, and I think as we can line that up with the types of activities that folks are doing. Anecdotally, I will say that what we're seeing has been driving a lot of success, and I'll put in a plug for those of you who are assisters out there, or anyone who just wants to join. Every Friday at 2 p.m. we do a conference call or a webinar for folks working on enrollment, and tomorrow we're going to go through some of the evidence that we have seen about what's really working. So I don't think any of these are surprising to the folks who are working. Shockingly, nights and weekends work really well, right? That's when people aren't at work and they have a little bit of time to focus on some other things, and so people who are able to have those alternative hours are seeing a lot of success. Folks who are doing enrollment using classroom style type enrollment as opposed to one-by-one, individual visits are having a lot of success. Obviously there are folks who are more challenging and are going to need that personal one-on-one, but if there are ways to do some more group work, then obviously the coalition work. link with your partners, make sure that you're doing those large events. Again, we're seeing really great numbers from that. And, so we're going to go through, I don't want to steal our thunder for tomorrow's call tomorrow too, but we're going to go through some more of that and link it to real data to make sure that we know that we're being successful.
Phil, in Kentucky, how do you know that your outreach is working?
Well, we were charged with the task from our governor to improve the health of our state. And that's not going to happen overnight. So, but that's the goal. We were asked, questions like, how many do you hope to enroll by January 1st? Or how many, by the end of the first open enrollment period? And we kind of backed off of that because, the goal is to improve the health of our state. Now, certainly, if you start with the proposition that more people with coverage equals health improvement, which I think is a very easy jump to make. People have access to preventative services, mental health services, maternity, all these different things that they've never had before is going to improve the health of our state. So I think enrollments is basically the starting point there on the measurement. But instantaneous results are not going to happen here. The process is going to take, it took us a long time to get our healthcare system the way it is for Obamacare. It's going to take a while to get it where it needs to be. But the first step is the recognition that healthcare is a right, and so I think the Vice President hit it right on the head this morning. I mean, wasn't he great? I mean, I'm sorry, it was just wonderful. It was just wonderful.
How are you measuring your efforts?
Yeah, we are very metrics driven. Before we go out anything, we have an amazing group of people who are much smarter than me, looking at the data, looking at where it makes sense. The nuance here is, though, because so much of our effort is focused on the Latino community, the measurements for success are a little different. Not only are we looking at the metrics, how many doors did we knock? Can we get that 50% of people who are enrolling with us up? Like, what does that really look like? But also being able to provide educational information. What is insurance? What is some of that foundational pieces that we talked about? We're considering that success as well, particularly for the Latino community. For my community, it's also important that we provide additional, cervical cancer screening, why do you need them, breast exams, those types of things. And so we're also going to measure success by how many people also visit our health centers. Also, how many coalition partners on the ground do we have new partnerships within the Latino space and just writ large? We really are, and I mean this sincerely, we're really looking at different bands, I guess, of success and what that means from metrics and money spent to the education and the good work we're able to do in the community. So it's a lot of work, but I think so far we're doing pretty well.
How are you measuring your success? How do you know which strategies are working and which ones aren't?
Yeah, I think similar to the other panelists, we track a lot of the data. So all of our CACs ask folks, how did you get here? Was it that you met a healthcare reform trainer at your local library? Did you get an email? So where are folks coming from? So, is our trainer program equaling enrollments? We also ask all of our trainers to report back. So they're sending us their sign-in sheets, reports about how their events went. So we actually know how many of the folks that we've trained are out there talking to people and how many people that they're talking to. So that's a big, piece of the data. I also like now, every time I get Google alerts about our organization, it's not necessarily one of our staff, but it's a lot of these trainers that, are working with their local paper to post the fact that, they're a FAN certified trainer, they like the fancy title, and they'll be at the local library educating people on healthcare reform. So I think there's those other metrics. And also, if folks aren't meeting, the 12 trainings they need to do a year, what is it we can do to help support them better? And we also often survey our coalition partners about, do you think the webinars we're offering or the CAC network that we're offering is useful? And if it's not, what can we do better? Or, what do you really like?
Yeah, that's all really helpful. I think figuring out the connection between the work that we do and the impact that it's having is a really critical element of things that we need to be thinking about for how we're actually going to accomplish this. How do we know whether we're doing the right things, and could there be other things that we should be doing instead, and how would we know what those were? Are all things that we are all struggling with, I know, on a regular basis, and I know all of you are thinking about that too in order to make your work as successful as possible and as effective as possible. And we would really welcome through the course of the year if there are things that you discover that are that you think have been particularly helpful and particularly resonant in the communities that you're working in. We'd love to know about that so that we can share that with other people. As we go through this, it's all brand new. And it's all the first time that we've done a lot of this work in the communities that we're working in. And so many of us are new to outreach and enrollment issues as well, that it's really helpful to be sharing that information as broadly as possible, and we would love to be able to help get that information across. How many of you are, I've asked this question I think slightly differently before, how many of you are actually doing enrollment assistance? That's a significant number of people, and it's reflective of the questions I have here. So Mandy, here's another one. I know lots of us, especially those who are enrollment assisters who are not lucky enough to be working in a Kentucky context or a California context, but are working in a state where things are more dicey. They're more difficult politically, and there's been a significant amount of pushback in a number of states on outreach efforts, and particularly with regard to enrollment assistance. And some states have been issuing regulations that make it harder for enrollment assisters to do their work by adding extra training requirements or making assisters pay for training or for background checks or for other things that are having, in some cases, a very significant dampening effect on the number of programs that are able to do this work and the number of people who can do this work. Is there anything that CMS is considering that will help make assisters' jobs a little easier?
Well, I certainly want to thank you for all of you who are doing work in some very tough places around the country where it's very, very challenging to do the work, and just thank you for hanging in there with us and doing the work that you do every day. What we can do in terms of the state regulations, we have often worked with the State Department of Insurance prior to those regulations coming out to try to get them into as best a place as possible, to get them to understand what our training guidelines are, to make sure that they understand what standards that we're holding folks to so that they don't feel like they need to up those standards in ways that might be inappropriate. But when there are costs associated with those, we certainly want folks to be able to use their grant dollars to be able to pay for any of those costs. Same with our health centers, to use their health center and enrollment dollars to pay for those costs to try to offset. Again, it is, it's really more the time that really is an issue. And at this point, we haven't preempted any of the states from saying that we've allowed them to implement their regulations at the state level, and that's included background checks and additional training. And so far, while we know it's burdensome, we don't feel like it is impeding their ultimate ability to jump through some of those hoops. And so we've sort of let that be, and I think that's something we're going to need to look at for a year or two.
The one thing I would point out, and I think folks here, I've heard from a number of people, is that in some of these states, the same rules apply to CACs as funded navigators, and so that's had a significant impact on the number of CACs that are able to do that work in the states.
We know that that's an issue. Luckily, in the majority of states, it's actually been confined to navigators, which which is fine. And at least they can use their grant dollars, but we know it's an issue, and it is definitely on our radar.
We still have many things to work on for next year. So I actually have this question for Mandy and for Bill, which is inquiring about, for the FFM, will the shop marketplace be operational in 2014? And then Bill, I know that that Kentucky is actively working on its shopping experience as well. So I was wondering if the two of you could address SHOP for just a moment.
Sure. You know, our SHOP is functional. Our system is functional when it comes to SHOP. We elected to go full bore and allow employer choice and employee choice. But the experience that somebody receives when they go onto our website as an employer or as an agent who's trying to help an employer or a navigator who's trying to help an employer is just not very user-friendly. You know, agents, for example, are used to putting together quotes. You know, they go out and they give a list to an insurance company, you know, what their health status is and all that kind of stuff, and they come back with a quote. And that's something that they can take, and then they show the employer, here's where you ought to go, this company or so on. We couldn't do that on the way our exchange SHOP was set up. So we've actually established a task force consisting of our SHOP. We have subcommittees. SHOP is one of our subcommittees. And agents and navigators are another subcommittee. You know, agents and navigators haven't always gotten along. You know, agents were very, very threatened, I think, in the beginning from, you know, they have to have a license to sell, solicit, or negotiate insurance. And they're thinking, well, these navigators and in-person assisters are going to come in. So we put them in the same room together and worked out a process so that agents were satisfied that they still have a place in this, and navigators were satisfied that they knew what their bounds were, if you will. But a task force to come up with recommendations about maybe some of the policy decisions that we made in SHOP. For example, Kentucky requires that the employer pay at least 50% of the premium for their employee. That's not a federal requirement. Now, it's a requirement in order to get the tax credit, but you don't have to. Of course, you know, it's all volunteer anyway in the small group market. We also required 75% participation requirements. That is, at least 75% of those eligible and that otherwise are exempt have to participate. So these were policy decisions that we made. Were they good ones? Were they bad ones? We had a very small response in our SHOP. 14 employers signed up for coverage effective January 1st. That's not very good. Of course, as was mentioned earlier, the SHOP is a continuing open enrollment period, as is Medicaid. So we're trying to do some things to improve that SHOP, but I've forgotten the question.
So you're improving your shopping experience.
That's right. That's right.
And you're working to try and get more than those 14 employers signed up.
Daggone right.
Okay. Andy, what's the word on SHOP from CMS?
I would say similar. SHOP is open, and it is a manual process right now. But the goal is for the 2014 open enrollment, which is sort of funny because SHOP doesn't really have that traditional open enrollment. But yes, in the fall of 2014, the idea is that the online system will be built out.
Okay, thank you. Apparently we have some breaking news out of Missouri where a federal judge has enjoined the navigator law there. And so there is some activity in Missouri to try to help out and make it easier for navigators to actually do the job that they have been tasked with, which is very exciting news. And thank you, Missourians. So those Missourians are going to need to get to work. Let's go get some people signed up. So let me just ask each of our panelists to maybe give a couple of closing remarks. And if you can, I guess what I'd like to try to focus on is, we've been talking about lots of different aspects of this system and some of the lessons that we've learned in doing outreach and connecting one-on-one with people, making sure that we're collecting stories, that we're sharing, and that we're executing that word of mouth to the best degree that we can. And we've done, I think, given all of the challenges that lots of us have been facing, both with the website not working, with some limitations in what we can do in terms of in-person assister, with limitations in funding for in-person assistance, with the political challenges that we have been facing in so many states, I think we've done a great job in starting to get the word out. But we clearly have a lot more work to do, and we haven't yet reached all of the uninsured. We haven't yet reached the lowest income folks. What is it that you'd like to see happen in over the next year?
I'll start.
Why not?
Well, so just in closing again, just another thank you, and I hope that you leave this conference energized, excited, and ready to work when you go home, because we need you. The next 10 weeks are going to be really busy. I think March is going to be incredibly busy in a good way. It's what folks have been waiting for, working towards, and it's going to be really exciting. I think what I would ask for folks to focus on are the folks that are most challenging to reach, those that don't know about healthcare.gov other than that it was a mess, that might have language barriers, that think they're invincible, that don't think that there are any options out there, that think this is out of reach for them. I mean, we need to go out and knock on doors literally and find them, and hopefully just present with options and let them make choices that are right for them and their families. So just thank you again, and please keep in touch with us. Join our calls on one more plug for Friday at 2 p.m. We're sharing lots of information both on Fridays and through our newsletter. Sometimes that's the only mechanism we have to get out guidance. So I hope you connect with us on those. And just again, thank you so much, and thank you for having me here.
Thank you. Bill?
Sure. As I mentioned earlier, 640,000 people were uninsured in Kentucky before we started. We got 162,000 people enrolled in something. They haven't all paid their premium yet, but they're enrolled. And so we still have a long way to go. And part of this, as she mentioned, was trying to identify those pockets of individuals that aren't getting, when we look at these uninsured numbers, we track it by county. Now, Kentucky has 120 counties, believe it or not. And so had to do with how long it took a judge to ride from one county seat to the other. If he could do it in a day, that was good. So we had to come up with 120 counties in order to accomplish that. But anyway, I think to reiterate too some of the things that everybody said here. We're just going to keep our nose to the grindstone. Hopefully there will be some things that will allow a tweaking of some of these requirements, either through a regulatory process at CMS or at HHS or Congress, if that's possible, that will make this better than it is. And it does have problems, but hopefully people will come to their senses and make the improvements that need to be made.
Melissa, what are we going to do? How are we going to finish our job this year? Go out with a bang.
I think that's a big question. I think for us also it's about, again, making sure we get all the information out so everyone knows their options and knows how to pick them, and to the point of those who maybe are least likely or who we've never engaged with before is extremely important. I think from a tactical perspective, a way to actually get that done is to expand our reach. I know you guys are doing this on the ground, but I do think even from Planned Parenthood sometimes it was a little surprising when we just kind of took that step back and said, who have we never engaged with on the ground and who's all in this fight together? And at the same time, some of the tables at the states, when Planned Parenthood, when our organizers have stepped up and said, we're in this fight with you, that other people have also been surprised, which is interesting since we're a healthcare provider, you know? So I think it would be amazing to be able to go into a state and know that everyone is on the same page. Everybody knows where everyone is in the community, who's knocking on what doors, who's calling through what lists, and it's a really coordinated effort so that we're not duplicating efforts and we're not talking to the same people. And we're really getting into those households, particularly for mixed status families, and seeing who all can really benefit from this and not just taking some of those conversations at the door and then leaving. So it's my dream.
Antoinette? I have a couple dreams. So the first, is just keep on. I'll say this again, no matter how big or small your organization is, I think we all have a role to play, and we all really need to play that role, and it doesn't end on March 31st. So we also have to educate people that March 31st is not the end of this, and we're in this for the long haul. I think people tend to forget that, and I think my ultimate dream, if we could accomplish it in the next year, is for Pennsylvania to expand Medicaid in a way that makes sense, that doesn't harm constituencies, and for all of the other states that are in the similar boat to expand Medicaid as well. So I hope we all leave here, boots on the ground, and finish this by getting Medicaid expansion done and getting everyone possible that we can reach enrolled.
All right, well, I want to thank all of our amazing panelists. Let's give them a round of applause. And I want to thank all of you for coming and for being here and for all the hard work that you're doing. And I cannot wait to be back here at Health Action 2015 when we can celebrate about not only the 2 million people we've gotten signed up for Marketplace and the 6.5 or some odd million people that we've gotten signed up for Medicaid, but the many, many more millions that we will be enjoying the healthcare coverage that they have and the peace of mind that come with it. So thank you all very much, and we'll see you the rest of the conference.